Sydney Akelado, third-year resident. I'll be your host during the tour of the Obstetrics and Gynecology OB-GYN residency program at Navicent Health. Today, we'll be answering some common questions that you may have, like what's it like to train at Navicent Health and what the curriculum covers. In a little bit, our program director will give you a fantastic introduction to our OB-GYN program. Then you'll take a tour of the facilities where you'll be doing your training. You'll also have a chance to hear from other residents about their residency experience. We hope this video will give you a good introduction to our program and will encourage you to apply for an OB-GYN residency at Navicent Health. So let's get started. So, what's it like to train at Navicent? As a resident, you'll have exposure to all of the major subspecialties in obstetrics and gynecology. You'll get one-on-one teaching from our amazing faculty and attending physicians in town. Our program curriculum, coupled with a diverse patient population, gives you a complete and diverse OB-GYN experience. Because our health system serves as a major referral center for Central and South Georgia, you'll get an exposure to an array of pathologies and high-risk obstetrical and oncological patients not often managed in community hospitals. Speaking from experience, I can tell you that a residency at Navicent will give you all the education, clinical experience, and confidence you need to be a strong OB-GYN physician. Being a third-generation OB-GYN, I can assure you that was a high priority for me. Now, I'll let you meet with our program director, Dr. Kitchen, to learn more from the person in charge. Catch you later.
Thank you for joining us today. I'm Dr. Felicia Kitchen, Program Director of the Obstetrics and Gynecology Residency Program at Navicent Health. We're proud of our OB-GYN program, which has been affiliated with Navicent Health and Mercer University for over 50 years. These traditions give the four-year OB-GYN residency a strong foundation in education and teaching of clinical skills for our residents. Our board pass rate is well above the national average, and we attribute that to the protected education time and extensive clinical training. You'll also hone your education presentation skills by covering updated ACOG practice bulletins and committee opinions every week. With only 4 residents per level, there is ample opportunity to work with faculty and attending physicians. Our program also includes exposure to nationally renowned speakers through our Grand Rounds presentations. We are committed to giving the residents the experience they need prior to graduation. Within the first 3 months of training, our interns get early surgical training. Each year, we have more than 2,600 deliveries at our institution, and residents are involved in well over half of them. We also perform more than 300 hysterectomies every year. Many are minimally invasive robotic hysterectomies, giving residents the experience they need to get robotically certified prior to graduation. At Navicent, we offer a complete and diverse OB-GYN residency experience. You'll get exposure to emergency medicine, family medicine, gynecology, and more. Residents get experience in all the major subspecialties such as MFM, REI, GYN oncology, Uro-GYN, and pediatric adolescent gynecology. You'll enjoy a warm sense of camaraderie among our residents, faculty, and staff here. This is a very happy place to train and work, family-oriented and very friendly. Residents have been matched into virtually every subspecialty fellowship in OB-GYN. And whether you plan to practice in rural, urban, or suburban settings, our didactic and interactive lectures and hands-on training will enable you to develop the skills you need for a fellowship or to join an OB-GYN practice. Now, we'd like to show you around the Navicent Health campus so you can see for yourself the inpatient and ambulatory settings where you will be learning and practicing during your OB-GYN residency. Let me turn you back over to Dr. Akelado for a tour of these key areas.
Thanks, Dr. Kitchen. Let's take a bird's eye view of the campus and a look inside some of the most important facilities to the OB-GYN program. Navicent Health is a large and comprehensive health system with over 1,000 beds. Our primary hospital, the Medical Center, has over 630 licensed beds and serves as Level 1 Trauma and Tertiary Center for Middle and South Georgia. The main tower is home to our Family Birth Center, one of 5 regional perinatal centers in the state of Georgia. Since 1995, more than 50,000 infants have been born here. The facility features private OB assessment rooms, perinatal rooms for high-risk obstetrics, birthing suites, and postpartum suites, recovery rooms, and operating rooms. Here, the OB-GYN resident lounge is on the 3rd floor of the tower. The Beverly Knight Olson Children's Hospital is one of the newest state-of-the-art pediatric facilities in the state of Georgia and contains a Level 3 neonatal intensive care unit and provides a transport service. The Surgery Center includes 23 operating rooms, including multiple Da Vinci robotic systems with dual control consoles. We perform a broad variety of gynecological surgical procedures in our department, from abdominal, vaginal, and laparoscopic hysterectomies to pelvic floor surgery in both open and robotic invasive cancer cases. Perinatal Associates is Navicent's specialty practice that focuses on the treatment and care of women with high-risk pregnancies and complications during pregnancy, and providing state-of-the-art diagnostics and monitoring equipment and surgical expertise. The W.T. Anderson Health Clinic provides a range of obstetrics and gynecological services, including ultrasound exams, well woman exams, and clinics for high-risk OB. The Peyton Anderson Cancer Center specializes in the diagnosis and treatment of cancer patients, including breast cancer and gynecological cancer. The Peyton Anderson Health and Education Center, we call it PAHEC for short, is where we have our library, simulation lab, and conference centers, including Eversole Auditorium and Trice conference rooms. The Sim Lab also includes a designated teaching Da Vinci robotic console and multiple laparoscopic simulators that help us prepare for FLS training. It was during my 4th year medical rotation that I discovered how great the people and faculty in the OB-GYN department were. I could clearly see that I would get the experience I needed while working with strong generalists in both OB and GYN. Besides that, we have a great culture here with wonderful faculty, staff, and residents. Our program has a lot of fun and really encourages us to get to know one another. Whether it's going to a retreat, locking ourselves in an escape room, or just playing board games. While we aren't planning to do any of that today, I would like to introduce you to several of my friends and coworkers.
Hi, I'm Dr. Vincent Fang.
My name is Lexi Allen. I am an OB-GYN resident.
My name is Monet Fennell. I am a second year.
My name is Cynthia Rowland. I am Morgan Castleberry.
Nancy Sakari.
My name is Sims Johnson.
I am originally from Gainesville, Georgia.
Hawkinsville, Georgia.
I'm originally from Taiwan.
Atlanta, Georgia.
Anderson, South Carolina.
Minneapolis, Minnesota, but I grew up in New Mexico.
Metter, Georgia. Where is that? Metter is about halfway between Macon and Savannah.
I was 19 when I first realized I wanted to be a doctor.
There's always that cliche of like, oh, I've always wanted to be a doctor. I was in kindergarten and I told my mom I wanted to deliver babies.
I was 7 years old.
Biggest pet peeve as a resident?
Feeling underprepared.
Apathy.
I hate writing notes.
I don't have one.
Bless your heart. If medicine didn't work out, I would probably be a chef.
I love to cook. It's my favorite thing to do.
I wanted to be a flight attendant.
I have 2 cats, so I play with them.
That doesn't apply to me.
We're proud of our OB-GYN residency and the first-rate physicians we've trained here over the years who have gone on to successful careers in the Macon area, across Georgia, and the country. Let me introduce you to one of our amazing graduates and faculty members, Dr. Misty Patel, who will share her experience in teaching and working alongside our residents.
As a new attending, something that I'm just getting to see is our interns and second years kind of step up and take a more leadership chief role. And it's probably the most gratifying thing that I found. It's so rewarding to see them find their feet as an intern in a second year and then step into the operating room as a chief a few years later and really be able to take charge. My name is Misty Patel. I'm a maternal fetal medicine specialist in the OB-GYN department, and I'm an assistant professor at Mercer University School of Medicine. I approach my role as a teacher and a mentor by remembering when I was there myself, because I have been exactly where these residents are. I like to encourage the residents to be autonomous by developing their own plan of care for the patient, and I see my role as their mentor as someone who can help tweak their plan, help them think of things that they haven't thought of, maybe point them to relevant literature, but I do like for the residents to take the lead in patient care. I think empathy is really important, and really trying to take care of the whole patient from the physical perspective, mental perspective, and social perspective. The piece of advice that I would give new interns starting out is to really take advantage of your time in residency to do hard things. Be involved in the hard cases, learn from the hard patients. It's so temporary, and this is your time to learn, so challenge yourself. You can do hard things.
We are proud of the faculty and attendings on our team who are making the difference for our OB-GYN patients. We hope you'll consider applying to our program. It will give you all the one-on-one training you need to prepare for an exciting career as an OB-GYN. Thank you so much for joining us for this brief tour of our program.
While it's great to be a part of those stories of families welcoming children into the world, nothing beats spending time with my own 2-year-old son. My husband and I love to take our family outdoors, which is just one more reason that living in Macon is so great. It was only a few years ago that I was excited to learn that I had matched with Navicent's OB-GYN program. If I could give just one piece of advice, it would be to look for people who you enjoy working with and have similar goals to you. That's what I've learned, and so far it's worked well for me. We hope you'll consider our exciting OB-GYN residency at Navicent Health. Thanks again for joining us for the overview and tour. We'd like to wish you the best as you make your decision.